Okay. So I'm starting your 2 minutes time. Started 2 minutes time.
Okay, okay, ma'am. Next page.
One more page.
Next page, ma'am.
Time up. Okay. Started on time.
Yeah, okay, ma'am. Okay. Hello, I'm Dr. Kazi, one of the doctors in the clinic today. May I confirm your name and age, please?
Yeah, I'm Helen Mills and I am 34-year-old doctor.
Okay, Helen. So, Helen, I have gathered from your notes and also the midwife informed me that you are going to be discharged today, and she wants me to review your discharge paper. So to do that, I need to talk to you to gather some information because your case notes are available now. Is that okay for you?
Yeah, doctor.
Okay. So do you have any specific concerns or expectation from the today's discussion?
Yeah, actually, I do have some concerns, doctor. I wanted to know what is this bug, and I just think that those dirty toilets had means I got that germ from the dirty toilets.
Okay. So what bug? Do you know the name of the bug?
They said something like gas or something like that.
Okay. 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 I got that. So before going to your concerns, so as I'm meeting you for the first time and all the notes are not available at this moment. So is that okay for you if I just ask few more questions to know more about you?
Oh yeah, good, good.
Okay. Okay. So at first I will ask you a few more questions and then I'll also like examine with the presence of a chaperone and I'll try to find out the notes in the within this time and if available as soon as it is available I'll check that notes and also the investigation as you have mentioned that one bug is was present in that. And after that I can explain better to you. I will also involve the consultant and also write to the GP because you are going to be discharged for your appropriate follow up. How does it sound, Helen?
Oh yeah, that sounds great, doctor.
Okay. So Helen, can you please tell me more about your the problems that why you were admitted? Because I heard that you delivered recently. So what happened to you? Can you please explain?
Yes, definitely, doctor. Actually, after the delivery, I went home. because my son was not keeping well, and I wanted to be with him as early as possible. After a day, I thought of just blanking out, and I suddenly lost consciousness. And when I saw myself, I was in the hospital, and they were rushing. There were lights, there were sounds, and I was in the theater. They said that
Mhm.
there might be some internal bleeding, and I don't know. They mentioned something like pus and all those things, but nobody explained me what exactly had happened to me.
I am sorry that you have went through a lot, and it must be very difficult situation for you. I'm sorry, Helen. So, Helen, can you tell me that what infection or what type of problem just your baby was suffering with?
Oh, yeah, he was not keeping well. He was having some runny nose, cough, and cold, and fever, mild fever. So, yes, he was having this.
So how? Okay, okay. So how is the baby now?
And the baby is fine.
Okay, okay. Okay, that's great. The baby is fine now. So, what was the delivery mood of the delivery in your case?
Actually, yeah, I delivered this time vaginally, and Annie was a straightforward baby who come out very easily.
So no trauma, no wound, or no stitches in the
Nah, it
vagina.
was no, it was very simple.
Okay, no transfusion, anything like blood or blood products.
No.
Okay, okay, that's great. So, other than that, like just after that, how many children do you have at home?
I do have two children at home. Means with Annie, it
Mm-hmm.
is third baby. Previous one is
Mm-hmm.
4-year-old daughter. She
Mm-hmm.
born vaginally, and the second one, the son whom I'm talking about, 2-year-old, and he had a C-section. At that time, I had a C-section for breech presentation.
Okay, so this time you delivered vaginally. So, how are the kids at home also, like other two children?
Everybody's fine, doctor.
They were
Everybody's
infected?
fine. Thank you
All
for
the other
inquiring.
members also okay.
Yeah,
Yeah, yeah, okay. So all the other members okay, right? And like how is your bowel and bladder habit at this moment?
very well controlled.
Okay, any vaginal discharge or any foul smelling discharge or any bleeding?
No,
Okay. What is the condition of your breast?
they are fine.
Is the breastfeeding okay with the baby?
Yeah, I just wanted to ask that also because they had started me on
Mhm.
so many antibiotics. I'm just worried whether this will be safer to breastfeed my baby.
Okay. Can you name the antibiotic? What
Yeah, they
was
said
started?
something fluxazoline and all those things. They were higher antibiotics, pretty higher antibiotics. They were giving me through the tubings.
Okay. Okay, don't worry. I'll check your notes. Okay, so I have just informed my colleagues to bring that, and whenever it is available, I will check that, and I'll also inform my consultant and also the infection specialist doctor that is called microbiologist, so that we can decide that which antibiotic will be you will be discharged with, so that and we will ensure that it is safe for your baby as well. Okay.
Okay.
Okay. So Helen, do you have any pain in the or swelling in your legs?
No,
Are you taking any injection for the swelling or like
no,
for
no,
for the
nothing,
clotting
nothing to
problem?
worry. No, nothing to worry about it, doctor.
Okay, okay, that's great. And like anything, any other problems you are facing at this moment?
No,
Any fever or any other thing?
no.
No. So how was your pregnancy period?
Oh, yeah, it was straightforward. I told you, doctor, nothing to worry about.
Okay. And regarding your medical problem, was there any medical problem like any anemia or diabetes or any other problems?
No,
Any drug allergy or anything allergy to any medicine?
no,
What is your weight height ratio?
it's normal.
Okay. Are you sorry? I'm asking this some personal question. Do you smoke?
No, doctor.
Drinking alcohol or any other drugs? Recreational drugs?
No, no.
Okay. How is support home at home, Helen?
But yeah, my husband is there and my parents will be accompanying me. So very well supported.
That's great. And how are you coping? with all these things?
No, I just wanted to be at home, and I'm really little anxious because I'm scared that this should not come up again, and I should not be in a trouble. So, what things I need to look forward at home also. I'm worried about that.
Oh, okay, I understand. So this must be very difficult for you. I'll connect you to the counselor as well. Okay.
Okay.
Okay. And now, I'll, with the presence of chaperone, I will examine you. Is that okay for you?
Okay.
Just to check that because you underwent
I
an
am in a very
operation, just to
safe
check
hand.
that
No,
whether.
I'm safe, doctor. They had decided to send me home today only. So I just wanted to
Okay.
know what is this bug and why this has happened. Is it that dirty toilets?
Okay.
So I just wanted to know all those things.
Yes, if I understand. So now, Helen, I can see that you are alone here today. So do you want someone to be accompanying with you?
No, no, no. You can just go ahead.
Okay, so thank you, Helen. So, Helen, from the history and what you have mentioned, though the notes are not available, but as soon as it is available, I can check and reconfirm with you. But as you mentioned that the bug was like gas, so most probably the infection was caused by a bacteria that is known as group A streptococcus, one type of bacteria. Okay, and it is usually present in our skin and the throat. Okay, Helen.
Okay.
Usually, yeah, so usually it doesn't cause any problem to our body, but sometimes if there is like any problem, as you mentioned that your baby was suffering with the cold, okay, cough and cold, so in that type of cases sometimes it may infect to the other members of the family. So as it could be that you are being affected from that infection, and as you are just delivered, so your immune system was not maybe you are not very well, so that's why maybe you just infected with that bug and it was causing problem to you. Do you get my point?
Okay, doctor. Yeah, quite clear. Quite clear.
Okay.
Yes.
Yeah. So sometimes, like, if you are pregnant or after the delivery, or our immune system is not working up to the mark. So in that
Mhm.
cases, sometimes it may causes the life-threatening problems. But usually, it is just just present in our body, like in the skin and throat, as I have mentioned. Okay. And whenever we are taking care of the other family members, whenever they are infected with the cold sensor, they it transmits to our body. Okay.
Yeah. Time up. I'm giving you another 2 minutes. Okay.
Yeah, yeah. So, Helen, now coming to the management, as you have already managed with safe hands. So, as we are discharging you today, so I am giving you some lifestyle measure. You have to maintain that maintain the personal hygiene, hand wash properly whenever you are using the toilets. So, as you are thinking that the toilets can have like causing this problem, maybe so it may could be a cause. So that's why I am requesting you to you wash your hands properly before and after using toilets, and also whenever you are changing your pads, sanitary pads, and also particular care taking care of your other family members if infected. Okay. And specifically regarding your antibiotics, as you have mentioned, multiple antibiotics are ongoing, so I will also talk to my consultant and also the infection specialist doctor that which medicine you will to take after the discharge, and how many days, and what will be the doses, and we'll ensure that the antibiotics are safe for your baby as well. And sometimes also, like, I'll also connect you to the nurse specialist will tell you that how your wound will be cared, and when the stitches, if at all it is should be removed, they'll inform you. Okay, Helen.
Okay.
Okay. And regarding the visitors, like after going home also, whenever any visitors or carer or the other family members, whenever visits you, it is advisable that you use a separate room, and whenever they visit you, just to use gloves or disposable gloves or aprons and mask, it is better, so that they are not infected, and you have the better recovery. Okay. And
Okay.
and we will also document everything in your notes. Okay. And if anytime you come for the follow up, it is better you bring your partner with you, so that we can better describe that. And I'll also write an incident report, so that we can investigate why it happened. Okay. And so that it doesn't happen to any other women in future.
Mm.
Okay, and we will, after
Okay.
an investigation, we will be open, honest, and we'll inform you that why it happened to you. Okay, I'll connect you to the counselor, and also I'll write back to the GP so that your follow up is properly followed up, and also with your baby as well. Okay, and
Okay.
if any
Yeah.
time you feel any other problem like any fever, or difficulty in breathing, or any muscle pain, or in your own any other problem, or foul smelling discharge from the vagina, anytime you feel any problem, I'm giving you another contact number so that you can contact directly. Okay, Helen, do you have any other concern?
No, doctor. Thank you.
Thank you, Helen.
Okay. Your own reflection and then others'
Yes, ma'am, I was
opinion
taking.
and then feedback. Answer key.
Yeah, so ma'am, I was taking a long time for the information gathering, I feel. So
Mm.
that is the thing, and the
So you
time
will not
management.
pass the station. Yeah, you will not pass the station the way you had progressed in this task. Okay. Okay.
Yeah.
That is the biggest flaws in your presentation. Uh, Otherwise, you were doing at least quite okay. I will say not great, but you were quite on a track. You know how to go, how to be systematic when it comes to approach. Too much of extra information, too much of repetition, but still you could able to means communicate, and you should able to uh, complete with extra time. Okay, so let's go through. So that is your A. Still, in spite of that, do you think there are any negatives in this task? And positive, yes, you complete, you know how to go ahead, how what needs to be mentioned, what needs and how to guide this patient. Okay, lay her anxiety, that is one point, important point. So that was also you were able to do it at certain extent, so I think okay. um, any other information, you any other points you wanted to comment on your presentation?
Yes, so ma'am, it was like I was struggling that there was no definite guideline for this, so I was just
No, there is a guideline.
searching that
This
what
is sepsis in, no, sepsis in
sepsis.
pregnancy. There is a, yeah, there is a guideline. So
Yeah, yeah.
this case is a case of sepsis.
Sepsis, yes. Like I was searching for the any patient information that is specifically from the RCG. So later I found one, but so that's why I was struggling that what to mention.
Website addresses.
That is one
Nowadays,
thing.
they accept. No, if there is not a patient information available of that
Mm-hmm.
particular condition, please mention
Mm-hmm.
website addresses about group A streptococcus.
Okay, okay.
Website addresses, there are
In what?
many, na, plenty in NHS. You just write it down, group A streptococcus, NHS. This is a website.
Okay, yeah, yeah. So that was I
Website
didn't
link.
know.
Yeah, website link.
Oh, website
Nowadays,
link,
you
yeah.
can say that.
Okay,
Yeah, website link. Okay. Yeah.
okay, 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 ma'am. Okay.
Okay. Support group, it
Thank
is
you.
not needed. Yeah, support group, it is not needed. If she feels traumatic by the situation and not able to cope up with the situation, then only counselor. Do not assume and do not say counselor in between. Okay. Do not say counselor, because offering a extra people, offering a extra resources to the patient is again goes in against patient safety domain. You are not a patient safety, and you are not utilizing the resources mindfully in NHS. They're very
Okay.
keen to
Like,
use resources mindfully. This is a station where you only need to channelize this station without involving any colleague. Communication with
okay.
patient,
Like
it is
whenever,
there, it is not communication with colleague.
okay. Like whenever she was telling that she's feeling very anxious, that why it happened like that. In that case,
Yes,
can you
yes. So
tell
you are
counselor?
a ST5. You are a ST5. You can allay her anxiety. Yes, this was the event. The worst has been over now. You are in a safe place. You are in a safe hand. Just continue
Mm-hmm.
antibiotics, whatever has been prescribed to you, and report whenever there will be fever, any wound discharge, any urinary tract infection. Report us. I will be providing you 24 by 7 patient contact
Contact
details,
number.
and the GP will be in loop, and GP and midwife will definitely visit you and take a feedback from you, or have a look at your health, something like that. So that is anxiety, because I think, oh my, if I go home and again I may fall sick, then that is my anxiety. So that is your work to allay my anxiety. A counselor doesn't need here.
Okay, okay, okay. Thank you, ma'am.
So others, can you comment? Somebody, anybody would like to comment on her performance? I will be happy if people started giving feedback to others. I will be really happy. This person, I really wanted to see this person who is having a Arabic name, but the person is not coming up. Okay, she's not speaking or he's not speaking, because I don't want any surprises. So I know most of them now. Amna Sharif, Amna Sharif
Hello?
was, yes, yes, dear.
Yes, me. Yes, this strange name, this me, Sally.
Sally. Okay, Sally. Sally, from where
Yeah.
you are?
What? From Sudan.
From Sudan. Okay, Sally, Sudan. And you are going for November. Then what about this Amna Arif? I am seeing you for the first time, Amna. Am I so?
No, ma'am. I have taken your sessions multiple times.
Okay, so
But
this is
I'm
time
going
you
to
have
appear in online
changed.
November first time.
Okay, so you have changed your name because I
No,
am.
no, the same name.
Okay,
I
okay,
have
doctor.
attended
Okay,
previously
no worries. Yeah, no worries. So you are from?
from UAE.
Okay, UAE. Okay, no worries. Khurshid. Khurshid?
Sorry.
Dr. Khurshid. Dr. Khurshid. This is just a small introductory session. Dr. Khurshid, are you there? Are you listening? Okay, okay, just wait. So others, please comment on her performances. Then only we will go through the feedback or detailed feedback and the answer key. Please, 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 you need to find out the flaws in others' presentation. Then and then only you will understand what is expected and how to get corrected by going in a straight way. Please, please, please. Anybody? Tania, Tania,
Yes, ma'am.
feedback.
Mm,
No?
Actually, I joined late. That's why I'm not giving feedback.
Okay, okay. Manika ma'am, and then we will go ahead with my answer key.
Ma'am, she was
Hmm.
telling about the information gathering should have been little less, ma'am.
Hmm.
And
Very
she
good.
should have the informing about the toilets to the hospital management, and
Hmm.
that can be added. And we should
Is it a
explain that
source
it
of,
is not
is
coming.
it a so is it a source of infection? She
Yes,
said,
ma'am.
yeah.
You have to
Is it?
say that it is not the source of this infection.
Yes.
This
Yeah, it
comes
is
from
not
the
a
throat, especially from
droplets. It
children.
is from the
Yeah,
droplet
droplets.
infection.
Yes, ma'am.
Yeah.
That we have to ensure her also.
So she is not patient safety. This is against going in
Mm.
patient safety. Okay.
Mm.
Even applied clinical knowledge, if so far as if it goes come concern. Okay.
Ma'am,
Uh,
incident reporting, ma'am.
Ma'am, any incident report
Ma'am.
for this infection?
yes, the incident reporting needs to be done.
Mm. And
Without
Ma'am, I
incident
mentioned
reporting,
about incident.
we have
yes,
Ma'am,
you
I
to
mentioned
mentioned
about
about the incident
incident
reporting,
reporting. Yes,
and also
you mentioned,
the droplet infection. Yeah, and also regarding the droplet infection, I mentioned that your baby was suffering with the cough and cold, and mostly it
yeah,
was
yeah, yeah.
yeah.
You mentioned, but what you said, yes, it might the toilets, dirty toilets might have been the cause for this infection that goes in against patient safety. It is not a cause of infection. It is not a cause of streptococcus infection, dear. It is a droplet. So her son is sick, and that might be a source of, very sympathetically and empathetically. It has, you have to say, oh, yeah, I'm really sorry if you are thinking that the dirty toilets were the source of infection. But let me reassure you, this infection is not being uh, not being communicated or transmitted through dirty toilets. This infection is transmitted to nasal droplets. Okay, nasal droplets. So most likely your son might be having the similar sort of infection, and that has resulted into the sepsis. Okay, because your immunity is low down right now. And how is your son doing? So I will ask GP to have a look at him. Okay, is he taking antibiotics? And other members of your family also needs to be screened and treated. Okay, yes or
Yes,
no?
yes, ma'am. Ma'am, regarding the yes, ma'am, regarding toilets and the tampons or the sanitary pads used. So in one document I have found that they are writing for the prevention methods. They are telling that we should inform the patient that whenever before and after
Yes, so
toilet
that is
use and
hand
after
hygiene.
using the
Yeah,
sanitary.
yeah, yeah, yeah. So
Yeah,
see,
yeah.
that is a
So
hand
yeah,
hygiene
that is also
methods.
written.
Yeah,
Yeah,
no,
so
that
that was
is
also
written,
written. So
but
that's
that
why I
will
mentioned.
see, if you will see, that will not
Mm-hmm.
be, I will not give you mark for telling me and if you have to tell this information, you have to be very quick, dear, because by telling that
Mm-hmm.
you were not able to complete the task. You were My concerns, what are my concerns, those concerns you need to answer. And you have to guide me regarding a care plan, a systematic care plan, where I will be see what had been expected here. Clarify the patient's recollection of events, so you have to recollect the events. That means you have to gather the information. Concerns while awaiting case notes. Explain what is group A streptococcus infection, okay, which you could able to explain me. Respond to her concerns. Explain what you will do to ensure safe transfer of care to the community. Okay, so safe transfer of care to the community, that means you have to continually this. Okay, so that means you have to continue your antibiotics, whatever antibiotics you have been given. What do you think? They are not baby friendly, they are not breastfeeding safe medications. If you are not having any details, what do you think? What is your common sense is saying? I will not be knowing the name of the antibiotics, but my concern is, yeah, whether it is safe to continue, or whether it is unsafe for my baby. So a common thing, the most common thing, most of the antibiotics which will be prescribed in sepsis will be baby friendly. But still, there might be some tummy upset of the baby. If at all any concerns you see, you can report to the pediatrician. But they are all baby friendly. They are all baby safe for the in the breastfeeding. Yes or no? Others to comment. Others, please comment such at such crucial discussion when we are discussing something very crucial. Okay, so this you have to explain, dear. This you have to explain. Okay, we will go through it. You have to interpret the reports, interpret this discharge note also, what she's having. Okay, so that also we need to explain, and we need to say that this discharge summary is not proper. We will be having another details is proper. We will be filling a proper discharge summary once the case notes will be localized. Yes or not?
Ma'am, ma'am, yes, I do have one query here. As this is discharge summary and the midwife is telling, so uh, is it that if we tell the discharge summary is not up to the mark, so will it be a undermining to the colleague?
No, no, no. It is accepting the fact. That was a FY2 who has filled the discharge summary. So yes, my FY2 has not means has missed out on some important events or important points in the discharge summary. So I would like to correct it. I would like to correct it. You are accepting the fact. You are not undermining the colleague.
Okay, okay,
So
okay.
Ma'am,
being
Thank you.
transparent, being open and honest with the patient is also a patient safety.
if the patient asks for about what are the future implications after this surgery, she may ask, no, ma'am.
Most of the time, she may have some pain, some adhesions, chronic pelvic pain. She can have because of the adhesions, because of the infection. Those are the issues. And if it is so, then again that chronic CPP, PID, infection, ectopic, all those points
Yes,
only you
ma'am.
have to explain. Okay,
Okay.
if at all she asks. But here
Okay.
my concern was not that. Okay, so
Okay.
that can be left out.
Okay. Thank you.
Addressing concern is very important. Okay, so just go through the feedback what I wanted to tell you, dear. Okay, why you took so much time in explaining. Okay, I would like to tell you initially that Mrs. Kazi, Dr. Kazi. Okay, um you took initial 2 minutes just to start your task. Means starting of your task, that means history of present illness. So introduction, situational awareness, aim and agenda setting, this took 2 minute time. This is not acceptable. This is not acceptable. If you will consume more and more time, you will not able to complete your task. The time take and the time, okay, so that is the initial time what I say should be very crisp, clear, and it should be not more than 40-45 seconds. So it includes introduction, aim, setting agenda. If there is any situation, something like that, FY2 has filled a discharge summary, and midwife has asked you to see and debrief you about this patient, and concern. So this should not take more than 45 seconds, dear. Here you were repeating the information, you were saying, you started involving everyone here only. You will inform the consultant, you will inform the GP. So those things will not give you mark, will be a loss of time, will be more significant here. So now onward, I will suggest, if you want to come crack your station within stipulated time, minimize your introduction. That is first part of your task. Okay, first part. Then comes the information gathering. Okay, and then comes the information giving. That means the management part. So the second task, second part should be completed within next 3 minutes. That means within 4 minutes, your information gathering should be done. Okay, should be done. Just wait, I'm getting a call. Sorry for disturbances. Okay. So this information, the information gathering should be completed within 4 minutes time. That is one thing. Another issue, what was seeing in your case was okay. And you were paraphrasing me for each and everything, though, dear. No need, no need. If you started paraphrasing me, or if you started communicating back with the back with me, okay, for smallest of the smallest thing, you will not able to finish your task. You need to understand. Am I audible? I'm just asking all of you. Okay, you,
Yes, yes.
yeah. So
Ma'am.
you need to understand when you need to paraphrase. When I'm saying that I'm really anxious to go home, doctor, I'm getting nightmares, because if something like this happen again at home, it will be difficult for me. So then this is the time when you need to say, yeah, I can acknowledge your concern. I can see that you are very anxious, but do not get worried. We will be offering you 24 by 7 contact details. We will be offering, asking GP and the midwife to have a look at you. Okay, midwife will be visiting you. There are the midwife, community midwife, who will be visiting you to see about whereabouts. And I will be offering you 24 by 7 contact details. And when you need to come back, whenever there will be fever, wound discharge, any redness, sore throat, please report back to us. Okay, so do not get worried. The worst is over. So something like that, it is if it is so, then yes, you need to say some, yes, you need to paraphrase, you need to ascertain that no, it is not, you need to communicate back with me. But if I'm saying that I'm worried that these antibiotics will not be baby friendly, at this timing, paraphrasing me, communicating back with me doesn't carry any meaning, dear. You are wasting your time. Here you just need to say this word. Okay, I don't know what kind of antibiotics you are having, but I would like to go through the details, and your case details are not with me. We will find it out as early as possible, and then I will be checking, and then I will be saying whether it is safe to continue or not. This is a time consuming. As far as applied clinical knowledge concerns, the patient was managed appropriately in a obstetric unit, in a postnatal ward. This means the patient was on a right track of antibiotics. Okay. Here the sentence what one will be explaining to the patient will be, yes, uh, whatever antibiotics we will be prescribing in cases of this kind of infections are baby friendly and they are safe to continue. But sometimes the baby might experience some tummy upset. Please report it if there will be any tummy upset. You got my point, dear Dr. Kazi?
Yes, yes, ma'am.
Okay. So rather than stretching it and repeatedly saying the same thing, your case reports are not with me, your case reports are not with me, this will not give you marks here. Okay. And this has lost, this way you were communicating with me for every question. And that has cost you your time. Otherwise, information, when it comes to information gathering, you asked me relevant history, there wasn't anything. Uh, you are informed consultant, counselor, infectious doctor, so many people which is not needed in this task. It is only a debriefing task, or the worst has been over, you just need to debrief. You have to ask patient, have you did someone debrief you? If not, more in short time you have to debrief. Okay. Then the information gathering was quite appropriate. Information regarding the current events, information regarding the labor, information regarding the pregnancy, and information regarding the previous details. Here again, what you were doing, when I will be saying you that it was a straightforward labor, when I was telling you it was a straightforward pregnancy, please assume that it is a straightforward labor, it was a straightforward pregnancy. Max to max, you can just ask me whether you had a prolonged leaking, prolonged fluid loss, because that is another risk factor of sepsis. Yes or no? So if I am telling you that it is straightforward, take it as a straightforward. Do not go in too much of detail. Again, you are wasting your time in information gathering, which needs to be minimized. Because if I am saying straightforward, yes, it is straightforward. Drugs is not needed. Okay, what kind of drugs you are taking? Substance abuse, if you wanted to say, yeah, miss, you can say in that case, because she is a case of sepsis. So do you follow needle sharing practices, something like that? I'm sorry to say you, but that can be a significant history. That can be a significant history. This is your feedback. Okay, then we will go through the answer detail. uh, Previous pregnancy details you asked me: alcohol, smoking, medical, surgical, counselor, consultant. Every time, do not need to offer every. You offered me twice or thrice. Okay, you are involved consultant thrice. You offered counselor to me twice, and you involved your infectious doctor once. Okay, it is not needed. It is not needed. Okay. Max to max, you need to say that I will ask a GP to have a look at your baby and identify any early source of infection. Okay, if the baby is having any early source of infection. This is what hand hygiene was a very good point what you had mentioned. Even I had not mentioned in my practice. So lifestyle modalities, that means you need to follow a hand hygiene, simple hand hygiene. We will add it into our answer key. Okay, very nicely mentioned that point. Clinical incident reporting you had mentioned. Then that toilets I didn't like. Okay, this is a simple case. So vaginal discharge, redness of legs, DVT history, medications regarding DVT. Do not put, do not put. If it is a simple task, that means things are stable now. You do not need to complicate the things. You just go on what has been given and go in that direction rather than getting yourself deviated that, oh, it might be a DVT. Okay, max to max, you say that I will see whether we had assessed the risk of blood clot formation and offered her appropriate treatment. Okay, appropriate prophylaxis. So though that point you can mention, but apart from that, you do not need to mention whether you are on any medication, any blood thinner. Okay, those points are not needed here. So with this, then addressing my concerns and giving me a reassurance that the worst is over. Now you just need to go home and watch for the symptoms and signs when you need to come back. Okay, so that is what the task is. And the discharge summary which we need to rectify. Okay, correct it. So let's go through my answer key. Okay, uh, this is a patient which is there in the ward. The first thing, whenever this kind of patients are there in the ward, in the hospital, in the labor room, please address them by name. Do not ask. It seems very inappropriate that the patient is under you and you do not know the patient's name. So, hello, Mrs. Helen. I'm so and so looking after ward patients. How are you feeling now? So, this should come into your mind first question. If the lay will be there, if after such a big traumatic event, you are not worried about myself, you are not worried about things. You were saying so many things, but not never asked you how I am feeling as at present. Okay, so that is one important question, and I can see you are ready to go home, and the FY2 has already filed the discharge summary. Do you have any adequate support at home to take care of you and your baby? So this is again a lay questions to get a good attention from a lay. I am aware that you had a tough time after surgery, a tough time, and had a surgery after baby delivery. Okay. And I am here to explain you regarding the events and infection and proceed further with discharge once formality is completed. At present, I do not have a case paper, so I will continue consultation by asking a couple of questions. That means we are setting the agenda. We had mentioned that we are not having, but see, if mentioned within a stipulated time, this will not take more than 50-55 seconds. 10-second time you can plus minus do, but do not keep it very long, very long. Any specific concerns? Yes, I think what kind of bug I am having, and I think that poor quality of toilets could be the reason. I am so sorry if you are thinking that the toilets are dirty. I will report it to the cleaning department, but trust me, the dirty toilets are not the reason for this infection. Then and there we are going to say that. Okay. Now, what had happened? So, recollection of events. So, they had also asked uh, in the exam here, clarify the patient's recollection of events. So, you have to ask what had happened. I will give we will be giving you information from discharge from the hospital to the events. How I had presented. Okay. That event follow after that labor history. How was your labor? uh, you acknowledge, you paraphrase that yes, it was a difficult and tough time for me, say sorry for that. Then the labor details, antenatal details, and obstetric history, previous obstetric history. Are you what about your baby, and are you breastfeeding? Very important question. Did someone debrief you regarding the events? No. Any other risk factor? You wanted to know the risk factor, why this has happened to the patient. So diabetes, anemia, any long-term medication, labor details like water loss for long time, previous obstetric details, smoking, addiction, especially needle sharing, and BMI is very important here. Mental history, by looking at her mental status, if she is looking very anxious, very concerned, here you can offer her counseling initially by you. And if you are thinking that the patient is not getting stable, then only you can offer her a counselor. Okay, because of this traumatic event you might find it difficult to cope with the situation, and if you are finding it difficult, please come back, we will offer you a counselor. Okay, thank you for sharing the information. As you had a very bad infection by bug called as streptococcus, and it had almost costed you your life. It was a life threatening event. Okay, but due to timely intervention we could able to remove that pus which was there because of this infection. Initially we thought that it is a internal bleeding. Whatever information has been given to you, that means they thought of bleeding initially, but then they find it out that there is a pus, and they rectify it. So then we could able to find out that there is a pus. We had removed the pus, give you a thorough wash, and started you on a higher doses of antibiotics which are baby friendly, and observed you in HDU for 2 days after surgery. And now since you are stable, you are ready to go. So have you heard about this infection? This is one important question which I had missed out in my answer key. You can always check her knowledge. No, I have not heard about this infection. Okay, so this is a bug which is responsible for, which also you also mentioned, okay, mild infection of skin, throat, sepsis, and sometimes a sepsis which is severe and life threatening at a time. The source of infection can be anyone who is having this infection in the skin or in the nose droplets, or droplet infection. And if the immunity is decreased, then we are at risk of catching this infection within a no time. And our ability to catch infection during pregnancy and post pregnancy is very high because of low immunity, but not because of the dirty toilets. Okay. How do I will know that I'm safe at home? Okay, how do I will know that I'm safe at home? Your safety is very important for us. We will be writing to the GP and midwife to keep an eye on your health and your son also. Please continue all antibiotics which will be baby friendly and take a good care. Here you can mention regarding hand hygiene. Worst is over. Now you need to take care of your your baby's health. This will minimizes the future infection and red flags like any fever, pus from wound, any urinary tract infection. Please report us. I will be giving you 24/7 contact details. We also ask GP to assess your family members for any infection and treat them on a priority basis. Regarding suture removal, midwife or GP can be doing that for you. I will go through the records once available, and I would like to discuss further care plan and will follow up and we'll write the discharge card in details. Okay, in details we need to mention the discharge card, and here you can mention that the one copy will be provided to the GP and one copy will be in your record and one copy will be given to you. I also see whether your incident reporting was done or not, and if not, I will report it further so that we can minimizes the occurrence of such incidences in future. We will be seeing you in perineal clinic and discuss about contraception. As of now, I'm not aware whether there is any patient information leaflet, but regarding group A streptococcus, I can offer you website addresses and you can just close the loop. Close the loop means offering a documentation, debriefing, writing back to the GP and offering patient information leaflet to the patient. So you can, with this, you can close the loop. Uh, okay. So explain everything you have done. So you have 10 minutes and what you need to do, you need to understand what has been mentioned here, dear. Okay. uh, at least you had addressed my concerns, you were guiding me on a right track so far as it is very safe apart from that community toilet. Okay, that point that could have been answered in a different way, but apart from that the task was means well presented or well guided in a proper direction. So communication with patient, first woman will be need to put at ease. She is impart the information to the candidate's needs. She will need to explain what happened in a clear plain English, avoiding clinical and technical terms. Good candidate will say that there sorry this has happened, but that is probably could not have been avoided. Okay, we could not have had avoided this because it is our own body's immunity which is needed here. There will be an overlap of patient safety to ensure it is sufficient information regarding what to look out for over the upcoming days and weeks without frightening her. So communicating patient regarding red flags is patient safety and communication with patient. So both the domains are here. It is important to ensure she does not blame herself or her son, who most likely will be the source of infection. Okay. She will also need to reassure without hiding the truth from her. While many common conditions have pre-prepared information leaflet, it is unlikely that this condition will not be there. So here you can offer her website addresses or website links of the step group A streptococcus. Applied clinical knowledge, a clear picture and clear scenario many a times present. Please ensure what is needs to be explained, how to debrief the patient, how to tell her what signs and symptoms she needs to look forward when we will be discharging her. A simple task, simple debriefing task. Applied clinical knowledge, sorry, patient safety. As far as patient safety is concerned, now the acute episode is over. Very important, but she needs to continue medication. Red flags when she needs to, and what when she needs to report us, and what are the signs which she needs to report. Um, Upcoming days, since she had a laparotomy and infection, what needs to be seen? Okay, so she can ask for some support. Even mental issues will might come up, so counselor, if there will be any important any mental issues comes up, ask a help of GP and midwife to GP to check upon the children's regarding the any ongoing infection or group A streptococcus in the babies or in her kids. Future pregnancies is not needed here. We will be pressing on future pregnancy. Here we will be just looking for the contraception, looking for the recovery, and then guiding this patient in a upcoming important appointment where we will be guiding this patient regarding contraception, not now. Woman can be reassured that there will be an internal investigation, that is incident reporting. Okay. Competent candidate will quickly ask recollection of events, labor details, risk factor for septicemia, including her son's illness, using their knowledge for septicemic shock. So she was in shock, and explaining her in her lay language. Most probable explanation, okay, correct, but may use terms like it most likely, okay, most likely or most probable. Chronological events you have to create and you have to explain this to the patient. Explanation by reading discharge summary, even although it was an incomplete piece of paper, but you can still get information from that piece of paper. Okay. So overall, a good task means I still feel this is a very wonderful book. Everybody needs to be everybody please do this book thoroughly. Please take these books, um, the portion whatever they had mentioned, their examiners notes or something like that, they had given it very nicely what actually expected out of part 3 MRCOG student. Okay, so please see to it that you will complete more and more books with the new format of RCOG. They wanted you to have a proper approach to the scenario, and that can be learned by Lisa. Lisa is a, I will say that I always keep on saying that this is a Bible of MRCOG. Okay.